Hello and welcome to this video course on oral and injectable antihyperglycemic agents. I'm Tiziana Cambietti, registered dietitian. This video course on antihyperglycemic medications is important for a few reasons. Over the past few years, new classes of drugs have appeared on the market, as well as some drug combinations. Since the latest update to the Diabetes Canada Clinical Practice Guidelines, there has been a greater emphasis on reducing the risk of cardiovascular disease and on protecting kidney function. Some medications are now being chosen for their role in cardiac and kidney protection. We believe it is essential for everyone with diabetes to know something about their medication. Knowing its mechanism of action, the potential side effects, and what to do in specific situations helps a person with diabetes feel more independent when dealing with the disease. Effective diabetes management requires the active participation of the person with diabetes. Don't hesitate to ask your doctor, nurse, or pharmacist questions. In this video course, we will look at the causes of hyperglycemia or high blood sugar, as well as the treatments for diabetes, both oral and injectable, including insulin. Diabetes is defined as an impairment in the production or use of insulin, which causes high blood sugar. Multiple mechanisms may be involved in causing hyperglycemia. A reduction in insulin secretion, an increase in glucagon secretion. Glucagon is a hormone that raises blood sugar levels. An increase in glucose production by the liver. A reduction in glucose absorption by the muscles. Dysfunction in the neurotransmitters. Increased lipolysis, which is the breakdown of fatty tissue to make glucose. And a reduction in the incretin effect. The incretin effect will be described in a different section of this video course. Diabetes therefore manifests itself through the dysfunction of multiple mechanisms. This is why there are so many classes of drugs that target one or more causes of hyperglycemia. Antihyperglycemic agents are medications that act to lower blood sugar levels. Until recently, these medications were taken orally in tablet form. However, in addition to insulin, several diabetes medications must now be injected. Antihyperglycemic medications are always a complement to a healthy lifestyle, which includes eating a healthy and balanced diet, regular physical activity or exercise, and stress management strategies. In principle, at diagnosis, we try to control the disease through lifestyle changes only. However, if the glycated hemoglobin level is too high, medications will be prescribed immediately in addition to lifestyle changes. Glycated hemoglobin is a laboratory test that measures the average blood sugar levels over the past 3 months. For each individual with diabetes, their doctor and medical team will establish their glycated hemoglobin target. This target will vary for each individual based on specific characteristics. Medications may be adjusted until the glycated hemoglobin target has been reached. For many people with diabetes, high blood sugar or hyperglycemia will not cause any real symptoms for a long period of time. Then why is your medical team so focused on lowering your blood sugar values? Studies of thousands of people with diabetes have shown that a decrease in 1% of glycated hemoglobin decreases the risk of 37% of microvascular complications, such as those affecting the kidney, feet, hands, and eyes, 14% of infarction or heart attack, 12% of stroke, 19% of retinopathy, 43% of amputations, and 21% of death from diabetes. Attaining targets is therefore important for everyone with diabetes, even if the benefits are not immediately apparent. As mentioned, the overall goal of diabetes treatment is to reduce the average blood sugar levels. Specific factors will help to determine which drugs are best suited for each individual. These factors include the initial value of glycated hemoglobin, the state of kidney function, the presence of cardiovascular disease, the risk of hypoglycemia, the expected effect of the drug on weight, specific contraindications, the personal preference of the person with diabetes and their potential to adhere to treatment, and the costs and insurance coverage. This course has been made possible with the financial support of Rush Diabetes Care, a division of Hoffman La Roche Limited.